cost of health care in the United States of America is expensive and steadily climbing. Program after program has tried and failed as the federal, state government, and private parties try to make health care affordable and available to every citizen of the United States. There are a number of factors that are influencing the cost of health care. Health care expenditure, prices of health care tend to be higher in the U.S., the attitudes of Americans, the prices of procedures, and finally, the unhealthy lifestyles of Americans. First, what is driving up the cost of health care? Health care expenditure. One theory of this increased spending in America comes from prices tending to be higher. The United States also has a great percentage of private pay patients, which raises the cost of health care. As noted in Kaiser Education, since more people seek out specialists as opposed to primary physicians, this keeps the cost of primary care down, the less expensive of the two compared to the specialty prices with the higher of the cost. Next, one of the reasons the cost of health care is increasing is due to the change in many Americans' attitudes. Americans' attitudes towards health care have changed so much in today's world. Unlike in the past, many people in today's century are reluctant to end a family member's suffering, and instead they put them in a nursing home. The family member will undoubtedly get sick and have to make repeat trips to the hospital where they will run up astronomical hospital bills that will drain Medicare and Medicaid reserves. Patients that abuse government-funded health care programs are also directly responsible for driving up costs. Hospitals and clinics that accept these programs are often not reimbursed with what they spend on procedures or care provided to the patients. According to the Kaiser Family Foundation, they performed a study on the healthcare spending in the United States and Canada. It was found that expenditures in healthcare industry reached and surpassed $2 trillion in 2010. It is expected to keep climbing in the years to follow. Rise in unemployment. With a rise in unemployment and many Americans receiving lower incomes, the amount of spending in the health field is front and center of everyone's mind. According to the Kaiser Family Foundation, a breakdown of spending is as follows in order from greatest to least. Hospital care, clinical services, prescription drugs, net cost of health insurance, investments, health residential personal care, nursing home care, home health care, retail, and government administration. Now that I have spoken to you on healthcare expenditures, let's talk about the United States compared to the rest of the world. The United States spends about 5 times more just on physicians, according to Hicks in 2011. The greatest amount of this spent on specialty practices. According to Abelson, this causes an increase in the cost private paying patients will see. Different providers can and do vary significantly in the same geographical area on their prices. For example, according to United Health Group, a hospital in New Jersey that is the only one available to the surrounding population is charging health plans more due to a decrease in Medicare and Medicaid payouts. Now let's talk more about the cost of different procedures provided by healthcare providers. The cost of procedures significantly increased over the past 10 years. For example, the cost of surgery such as a knee or a hip replacement have increased by 70% of the previous cost, respectively. The cost of diagnostic tools such as MRI, CT, or PET scans have tripled over the past decade. Even life-saving surgeries such as an organ transplant surgery have increased in a step fashion. A kidney transplant in 2000 would have cost a patient 31% less than the same surgery today. The average American lives a very unhealthy lifestyle, which also affects our health care coverage. In comparison, according to the United Health Group 2010, the prevalence in obesity has helped drive up the cost of health care. It is not the disease itself that raises the cost of health care, but the conditions that result from the patient being obese. Diabetes, high blood pressure, sleep apnea, even cancer all have higher incidence in people with obesity. There's also a higher incidence of joint replacement surgeries in an obese patient. Gastric bypass surgeries and other weight loss surgeries have become more prevalent in the mainstream surgical cases. These surgeries and their post-operative care cost the patient more each year, and the insurance companies do not want to cover the additional costs. Many insurance providers list obesity as a pre-existing condition and will not offer coverage to obese patients due to the expected cost of the upkeep. However, the prevalence of all chronic conditions, not just obesity, has helped to drive up cost of healthcare in every field. Patients with heart conditions, lung conditions, high blood pressure, diabetes, and other medical conditions are living longer due to better medical care. Also, according to the United Health Group, longer living patients with chronic conditions mean more health care will be utilized. In conclusion, the United States government appears to be working to try to lower the cost of health care spending, but they have not succeeded thus far. The United States spends more on health care than any other country. Our attitudes and our beliefs have changed. The cost of living is driving up the cost of health care, and the cost of medical procedures is on the rise daily. Obamacare is one of the most recent attempts at trying to lower the health care costs, offering government-issued health insurance for everyone. According to Fiscaldo 2011, another attempt at lowering costs of health care is requiring employers of larger businesses to supply their employees with health insurance. This attempt at lowering costs may fail, as it increases the amount of private paying patients. Hopefully, in the next several years, they will come up with a way to keep costs down and help out our Americans.